So let's talk about medical health care sharing. Last night on Facebook, I saw a conversation. Somebody had actually tagged me in it because they knew that I offer plans that are medical health sharing plans. And there seemed to be some people who were strongly for it, and some people who just really didn't know what they were all about. So I thought that I'd take a little bit of time this morning to just go over what health sharing is. So I'll start with what they're not. One, they're not medical insurance. We should go ahead and get that out of the way and go ahead and say that. And that's a good thing. And you may ask why that's a good thing. I think you will agree with me as I go on and explain it a little more. Also, health sharing is not Obamacare. It's not the Affordable Care Act. It's not some cheap plan to get you out of paying the penalty for not having health insurance. What it is it's a community of people who come together and they decide that they're going to participate in helping share other people's burdens, other people's medical bills. And so mechanically it works a lot like health insurance, being that you go to a provider, you see the provider, and the provider will either go ahead and send in your medical bills to the health sharing ministry, from which those medical bills are paid using the combination of all the members' money. Or if your provider won't file it directly with the health sharing ministry, then you fill out a form, you send it to the health sharing ministry, and they either apply it towards your yearly out-of-pocket amount, or they'll send a check to you to pay your physician if you haven't already paid them. If you've already paid them, of course, you can just take the money and put it into your bank account or do whatever you want to with it. So, in that way, it is much like health insurance, but it's better than health insurance, and I'll tell you why. Is the medical healthcare sharing plans, they are controlled by their membership, which means that for the big decisions on how much should be shared, and the big decisions on how to change rules, and the big decisions on how if the guidelines should change, and all those big decisions have to be approved by the members of the health sharing ministry. I don't remember ever, not once ever, an insurance company sending me something in the mail that says, hey, we want to change this policy of ours. Are you okay with it? That has never happened, and it's never going to happen. And that's a good thing. That the health sharing ministries are essentially, on the grand big things, are run by their membership. Now let's talk about what they typically won't pay for. What they typically won't pay for are things like out of wedlock pregnancy. They typically won't pay for abortion except in the case of rape or incest. They typically won't pay for things like you making a real bad decision, like going out, getting drunk, wrecking your car, and being in the hospital. that's not in their mission of sharing each other's healthcare burdens, because you made a bad decision. You made a bad decision to go out there and get drunk and crash your car. They also don't pay for substance abuse. They do, however, pay for maternity, and specifically one of them will help pay for adoption costs. Additionally, one of them will also pay a death benefit. So if you die, they'll send money to your family to help out with funeral costs. Now, all this right here may not mean a whole lot to you, except that you get all of this goodness, all of these benefits, all of this, right, and the costs are extremely lower than any of the healthcare plans out there available today. It doesn't matter whether you have an individual plan or a company-sponsored plan. If you have a company-sponsored plan, you may be paying less than that, but your company is paying more. Let's talk about another thing that they don't pay for. They typically don't pay for preventative care, which is shots for your kids, colonoscopy, mammograms, and things like that. And that's a big deal to people, and I get that. But I can tell you from experience, because I am a Medi-Share member, and I would never let my wife go without her well woman exam and things such as that. So the cost of these preventative care visits are relatively minimal if you tell them, I want the cash price. The cash price for a mammogram is typically around $200. The cost to have it read is around $100. So, and that's on the preventative side. If, however, something comes up on that mammogram that shows that there are some issues, then it does become covered by the health sharing, because it's no longer preventative. Let's move forward a little bit. We'll talk about prescriptions. In prescriptions, each health sharing ministry does it a little bit different. So Altrua has a discount that they have. Alira, which is Unity Health Share, has a discount, and I think that there are a couple of their plans that actually cover some prescriptions. And Medi-Share, they don't cover maintenance prescriptions, but they do cover prescriptions that are aimed at getting you well. So if you're sick and your doctor provides you a prescription to go get medication, they will pay the cost of that medication. So there's a whole lot of things that are just so involved in this right here that I just can't possibly go over it in just one trip to work. And that's what I'm doing now. I'm driving to work. But I can tell you that me and my closest friends all have Medi-Share. And we have that because, well, number one, initially I looked into it because the cost is just so much less. So this year, the cost of health insurance, if I bought it for me and my family, would be around $1,600 a month. And that's with a $5,000 deductible before they pay 1 red cent. My cost on Medi-Share is just a little over $500, and that's for a $3,500 family maximum out of pocket. And so, but after I signed up on it, I'm totally sold on the program, because each month you get this statement in the mail, and it tells you that your money went to pay the cost of whatever name it is, John Brown, Sally Yates, whatever it is. It doesn't tell you where they live, and it doesn't give you any contact information. It also doesn't tell you what the illness was or anything like that. But it does say, this is where your money went to, and this is who you paid for. And could you please have time and say a prayer for them to help in their healing? And that, I was sold out, completely sold out with that. And unless something changed just drastically with the plan, I just can't see why I would go back to a standard health plan. Everybody that I know who has it, everybody that I know, and I know a couple people who've had some serious medical bills this year, everybody that I know that uses Medi-Share has had their bills shared, and not one has been turned away. So I'll close on this right here. If you're struggling on trying to figure out how you're going to pay your bills, your medical bills, how are you going to meet these ungodly amounts that cost for health insurance, I would ask you to consider a health sharing plan, whether it be Medi-Share or if it's Alira or if it's Altrua. Consider them. I think that once you sit down and study it, and if you talk to some people who use it, I think you'll be more than satisfied that this is a better way to go. And you can reach out to me. I'm at TWFG Insurance. I'll be happy to spend time talking with you. I'll send you any information and let you make the good decision on what's best for you and your family, and not so much what's best to line the pockets of the insurance companies. And that's my drive to work.